My treatment philosophy is generally to at least try to understand where patients are coming from first and foremost. It's more useful to sit down with a patient up front and sort of ask, what do they do? What do they like doing? Rather than, okay, you're Mr. Jones, you're here for your VT ablation. That's not as interesting as trying to understand at least how they have tried to live, and how their lifestyle has been impaired by their disease process. And once we have an understanding of that, we can begin to get a sense of how we can help them improve. We don't always get everybody back to where they had been, but we can certainly make things better. And that's where the conversation begins. Because what people are asking us to do and the kinds of procedures that we do are risky. And they go well 99.5% of the time, but we want people to be there for the right reasons. We want them to understand why they're there. And much of the visits that we undertake with patients is meant to educate them, to help them understand what has gone wrong with their body, what we can do to try to fix it, and how it might help them live a richer, fuller, and perhaps longer life. My special interest is in ventricular arrhythmia management and complex arrhythmias. We were kind of recruited down here to get an ablation program in ventricular arrhythmias established and growing, and to begin to develop a national presence in the treatment of ventricular arrhythmias. And so that's been my primary clinical focus, but I also ablate or manage patients with complex atrial arrhythmias, atrial fibrillation, atrial flutter, patients with some forms of congenital heart disease and arrhythmias. And then, of course, we implant things like pacemakers and defibrillators and do heart rhythm management. But my academic focus is primarily, my clinical focus is primarily in complex arrhythmia management and ablation. What we hope is a patient would choose us because we have the ability to provide just a comprehensive, team-based approach to their care. When we step into the EP laboratories at MUSC or into our EP program, the message that was given to me by my mentors, the people that trained me, and my last boss, who in Chicago is a very famous ablationist, very famous, he's a journal editor of one of the major cardiac EP journals. You check your ego at the door and you just work with people to provide the best care to patients. And so we do that. And the team has been building since I've been here. We're continuing to grow. We are bringing in world-class people, world-class recruits in terms of physician talent to work here. We have the latest in technology, and we have world-class nursing and technical staff in the group that we're trying to continue to reinvest in educationally. And so we're doing everything we can to provide at least the best chances for a really superb outcome for our patients.